Also tonight, Ballad Health and Watauga Orthopedics are feuding over the hospital system's change in trauma care. The orthopedic group says Ballad is taking independent orthopedic groups off of their on-call coverage at Johnson City Medical Center, a change that is supposed to happen February 1st.
But Ballad Health says Watauga Orthopedic's statement issued late yesterday is partially false, and they're just following national practices. Ansley Daniel spoke with leadership at the orthopedic group and at Ballad Health. Ansley, help us understand why these two are at odds.
Well, Josh and Sarah, Watauga Orthopedics says that Ballad's move amounts to limiting a patient's right to choose their healthcare provider when it comes to serious orthopedic care. But Ballad says that's not the case and that it's best practice for a level 1 trauma center to have a fellowship-trained orthopedic traumatologist. Ballad Health says it's been a long time coming. A large enough team of trauma-trained orthopedic surgeons to offer the best care for the worst emergencies at Johnson City Medical Center's Level 1 Trauma Center.
It's less stress on their heart and lungs, too. The sooner we get to them, there's literature out that says, orthopedic traumatologists can reduce the length of stay of all critically ill, injured patients.
Ballad is also starting a 2-tiered on-call system with its 4 traumatologists taking most calls. They say it's for better patient outcomes and to help gain American College of Surgeons certification for the trauma center.
Part of that, the objective was to have them provide oversight on the injured patient so that we are assuring the best quality of care that we can for patients in the region.
That leaves one local orthopedic group unhappy. They can join the 2nd tier, but one Watauga Orthopedics leader says the current system has been working great for years.
We worked with the orthopedic trauma surgeons. We would stabilize the patient, and then the next day we would refer patients to them that were appropriate. And that's the way that's worked for a number of years, and that's the way it works at most of the centers that I'm aware of.
Dr. Burns acknowledged the tiered on-call system is not a certification requirement. And Dr. Duncan said the call change increases the chance of Watauga patients ending up with other providers when they're injured.
It seems to me that Ballad right now with these actions is inhibiting our ability to care for the community and our patients.
One of Ballad's 4 orthopedic traumatologists disagrees. He says patients can make the decision as to which doctor provides their care, and electronic medical records will show which orthopedic provider they've used in the past.
Their entire history is visible, and usually it doesn't even come to an orthopedic seeing them. It's usually the ER doctor already has that information and says, "This is Bob Smith's patient, will you please call Bob?"
Duncan said Watauga doesn't know any of recourse since it has made its case before JCMC's Medical Executive Committee, which unanimously approved this change. Crank said that change may be the difficulty and that he'll continue contacting Watauga frequently with referrals.